Today we are discussing a topic that's close to many hearts, which is treatment for children living with HIV. HIV is treated with a combination of 3 drugs, and the treatment is called antiretroviral therapy or ART. Though these drugs do not kill the virus, they control its growth and thereby allow these children to grow and develop and have a similar quality of life to their peers. Hence, ART is not just a treatment, it's a lifeline for children living with HIV and has to be taken lifelong. In this guide, we'll explain how to give ART to children and manage side effects, if any. Our aim is to empower caregivers of these children and to enable them to provide the best possible care for their children living with HIV. Care for a child living with HIV requires the caregivers to have information regarding lifelong treatment and some tips for doing it the right way, and we are here to support you with that. Child-friendly ART drugs are now available free of cost at all ART centers across the country. These dispersible tablets mix in water easily and are a boon for smaller children who may have difficulty swallowing pills. A new drug, dolutegravir 10 mg, is now available for children weighing less than 20 kgs and can be given even to babies as young as 1 month old and weighing 3 kilograms or more. Dolutegravir or DTG is the best drug available to fight HIV. It works fast and effectively on the HIV virus and lowers HIV virus count within 1 month. It's a safe medicine with very few side effects. These drugs are effective only if taken daily at a fixed time. Missing doses makes the HIV virus stronger and these drugs will then not work well. The aim is to not miss a single dose. As mentioned earlier, children are given a combination of 3 drugs. Along with the DTG 10 mg tablet, usually the child needs to take tablet AL. Some kids may be advised by the doctor to take ZL instead of AL. Dose of the tablets depends on the weight of the body and should be increased as the child grows. Hence, it is essential that during each ART center visit, the child's weight is recorded and the ART drug dose is decided accordingly. Now let's talk about how to actually give the tablet dolutegravir 10 mg. The first step is hand washing. Make sure your hands are properly washed before you give the medicine. While it is best to give the medicine in clean water, it can also be given with milk or some other food. Use a clean spoon and glass or katori to dissolve the tablets. To dissolve half or up to 1.5 tablets, 1 teaspoon or 5 milliliter water should be used. For 2 tablets and 2.5 tablets, 2 teaspoons or 10 milliliter of water should be taken in a small glass or katori. After adding the correct number of DTG 10 mg tablets, make sure that the tablets are fully mixed in the water. If you see any bits or lumps, stir with a spoon. Do not use more water as the child might not be able to drink the whole amount and will not get the correct dose of medicine. Now the medicine is ready to be given to the child. Ensure that the child takes the complete amount of solution. If there's some medicine left in the glass, add 1 teaspoon more of water, stir and make the child drink it fully. The medicine prepared needs to be taken within 30 minutes of mixing or dissolving the tablet. The DTG 10 mg tablets are flavored and are usually taken by children without any fuss. However, if your child does not like the taste of the pill and water, the medicine can be given with juice, curd, milk, etc. It's very important to give the ART medicine daily at a fixed time as per the child's routine. It's important to observe the child for 30 minutes after giving the medicine. If the child vomits within 30 minutes, a repeat dose of medicine should be given. Any vomiting happening after 30 minutes of taking the tablets does not need repetition of the dose. Life gets busy and sometimes caregivers might forget to give the dose. If this happens, give the medicine as soon as you remember, but don't give 2 doses at once. It is very important to give the medicine at the same time every day. One can use reminders such as mobile alarms, etc. Few important tips to get it right. Keep the ART pill box in a cool and dry place away from sunlight. Traveling can mess up routines, so plan well. Take enough medicines for your entire trip. Sometimes some kids might feel sick after taking them. Side effects like nausea, vomiting, stomach pain, feeling tired, headache, or trouble sleeping could happen. Don't worry too much, but do share these events with your doctor to assess their severity. Mild side effects usually go away on their own in about 2 to 4 weeks. Some kids might have serious side effects like skin rashes, high fever, or jaundice. If this happens, contact your doctor at your ART center immediately. Regular checkups are not just for refilling medication, but also for checking in on your child's overall health. Follow-up visits after starting ART are very important. Hence, always bring the child along for each monthly visit. The ART doctor would like to see how the child is feeling and will ask about any side effects. They will do a proper checkup and calculate the drug dosage as per the body weight of the child. Some blood tests are to be done regularly to monitor the effect of the ART medicine on the child. The viral load test tells us how much HIV virus is present in the blood. A report of less than 1,000 copies is an excellent report. It tells the doctor that the child is taking the medicine properly and the ART is working. The CD4 count tells us about the immune system. A high count is a good report. Do discuss these reports with the ART staff. The ART center staff is always there to help the child and the caregivers. Do not hesitate to ask them anything. Note down any questions or new symptoms which may have appeared in the child. We have learned a lot today about how to give the medicines, the importance of regular checkups, and taking the drug daily and not missing a dose. Remember that your child and family are not alone in this fight against the HIV virus. ART doctors and the staff at ART centers and community support groups are there to support you always. All the best for your commitment to taking care of your child and moving towards a healthier future. Thank you.